So looking at the interface, this is kind of what you're getting at the end of your analysis. The first thing you get is the most important, which is the FFR value, which straight away is going to tell you is this clinically significant or insignificant. The second is you get the 3D model of the coronary tree, which is color-coded by FFR, which very quickly to the eye draws you to the area of the lesion or the segment, particularly if it's a long diffuse lesion, that is of interest and may need to be treated. It also will give you an idea if there are multiple lesions in parallel or in series or in side branches and other aspects of the coronary tree which may also need to be treated. You can manipulate that 3D model and drag and identify where there is that step up or step down in the FFR to help guide you in terms of where you need to treat. That color pie chart you can see here depicted by C is the impact score, which characterizes, as I mentioned, the overall disease burden and the extent of myocardium that's impacted by that abnormal FFR. Above in those three panels, you have the angiograms, which are overlaid with the QCA and FFR to help you correlate what you're seeing angiographically with what the physiological assessment and output is. It's kind of like an overlay of what you're seeing on your screen routinely with the angiogram. And then finally, very importantly and very excitingly with this newest generation of software is the sizing tool and 3D QCA, which is incredibly helpful and can be adjusted to tell you what size stent should we be putting in and how long a stent should we be putting in to treat the area of interest. And this is incredibly useful because, as we know, our naked eye is not good at assessing the size of stents. We often underestimate the size of stent. We often underestimate the degree of expansion. And certainly a lot of studies show we miss the entirety of the lesion length. Now we have a physiological, hemodynamically governed way of sizing not just the diameter, but also the length of stent to be treated. So it's sort of the next step in appropriate PCI. And so this is what we see here. This is just a kind of live view of how the coronary tree can be manipulated here, in this case, rotating around to show, obviously, the different vessels. The lighter colors have a non-significant FFR, the dark red a more significant FFR. Now zooming in on the area of interest, you can see there's the overlaid stent in that segment. And we can manipulate that and say, okay, let's make the stent slightly longer because we want to go from normal to normal. And it's showing us on that rendering above what that will look like on the coronary angiogram. So if we decided, for example, we don't want to cover the side branch or we're happy to cover the side branch, we can make those manipulations here to help guide what we're going to do in terms of procedural planning.